everyone. This is Dr. Monica Du, a board-certified pediatrician, wife, and mom. And in today's video, we're going to be talking about breastfeeding versus formula feeding. Now, I know many of us have faced this question about whether or not we should breastfeed our babies or formula feed. So, moms, when we are bringing our babies home and we're trying to figure out what we should do, oftentimes, of course, we have the experience that we have had from our hospital visit. Now, in some hospitals, they are very breastfeeding friendly, and they will go ahead and have you put your baby or babies on your chest to get some skin-to-skin contact and begin that wonderful bond that will be forming between you and your newborn. And when you're doing that, it is helping to give your baby cues for feeding, in particular, breastfeeding. So some of us may already just start off right off from the top, breastfeeding our infants, and we just get into a routine and swing of things. And as I mentioned this, note just from my own experience 3 times over in breastfeeding my own infants that it does take time for you as the mommy to get used to the routine of breastfeeding. And it also takes the baby some time to get the hang of it. It is not specifically automatic. I have really not seen many babies that automatically know just what to do, and neither moms either. We have to learn it. It is a learned skill, and it is such a wonderful skill to acquire because it is giving so much nutrition and benefit to your infant. Now, there are some of us that are not able to do it, and that is okay. We all have our specific circumstances and the things happening in our lives that may prevent us from doing breastfeeding. But if we are able, it is definitely something that we should consider. Let's get into some more details about the benefits of breastfeeding. One, it is the ideal nutrition that you would want, if possible, to give your infant. It is literally balanced with multiple chemicals and signals that help to provide the health and nutrition and immune stability that our infants need. So, specifically, it helps to provide our infants very good immune protection as their immature immune system is starting to grow and develop. It has multiple immunoglobulins. These are the chemical messengers and workers in our body that help to protect us against multiple infections and diseases. For example, IgA, IgG, IgM, these are all important immunoglobulins that help protect us from a variety of different situations. Breast milk delivers these live antibodies to our baby just right then when we breastfeed them. And our immune system will actually tailor fit the information needed to keep our babies healthy based upon what the specific needs are. So, for example, if you are in the respiratory season and your baby's within the respiratory season, your body is going to tailor make the information needed through these chemical messengers to help provide the coverage and immunity to your babies to at least help them fend off infections. Now, of course, it cannot cover everything, but it greatly improves their chance of staying healthy, especially throughout these seasons where we may even be visiting family and friends more often, where we do need that extra boost and coverage. It can help to significantly reduce respiratory infections and diseases, gastrointestinal diseases such as really bad diarrhea, and inflammation that can come just even from the environment. and the things that we face every day. Moving forward from the infancy stage, it can even project into their future in terms of keeping them well and at bay from multiple childhood illnesses that we often see. That can be from asthma to allergies, even mental health issues. Some studies have shown moving into the realm of ADHD, behavioral issues, just multiple mental health concerns. Endocrine, it can help prevent even some hormonal imbalances and fluctuations that can occur. And why? Because it's delivering the optimal nutrition that our body and brains need to function and develop well so that we are less at risk of developing some of these childhood disorders. Breast milk provides a perfectly balanced solution for our brain development, cognitive development, for our gut and immune function, for our respiratory system, for our skin, multiple areas that we don't even consider or realize how much they play a role together. Not only does breast milk provide for better outcomes for our infants now and into the future, but breastfeeding in general and the release of that breast milk helps you to have better uterine contraction so that you can bring the uterus down after having your infant so that you can return back to your body and shape. It can also even protect moms against breast and ovarian cancers in the future. So not only are we helping our infants, but we're also helping ourselves to maintain our own health, go back to our pre-birth body, and to also help ourselves out even long into the future. It has even been shown to help moms prevent against endocrine disorders as well, such as type 2 diabetes and even cardiovascular diseases. Now that we have discussed many of the benefits of breastfeeding and breast milk, let's get into some of the benefits that formula may provide if ever this is needed. One, as you could maybe tell by now, I am definitely a cheerleader for breastfeeding and breast milk. It is honestly the best. But there are certain situations where a mom may not be able to do this, unfortunately. And so in those cases, yes, formula can be used, but always make sure you do your due diligence and research and find out what formula can be best for you. Honestly, they are made in order to try and duplicate many of the benefits of breast milk, but it can never, honestly, get to the optimal state that breast milk is inherently in. So it does have multiple vitamins and minerals, and companies have even added things like DHEA for brain and cognitive development, but these things are already in breast milk. But if formula is needed, do that research, find out if you can have good, organic, non-GMO, and well-sourced formula that you feel comfortable feeding to your infants. There are many, many products out there, so there's not a particular one that I would give to you in terms of naming, but I do often recommend if formula is needed, find an organic brand that has good, clean sources, non-GMO, and that has a good variety of the vitamins and minerals that are needed. One thing that I can say that studies have shown can be different in terms of breast milk versus formula is the vitamin D content. Oftentimes, mom's breast milk does not have as much vitamin D as a formula may have. So oftentimes, breastfed babies are recommended to go ahead and have supplementation with vitamin D. Much of the standard formulas that we are aware of have that extra vitamin D in there, and so it's not specifically necessary to supplement. Another thing is that breast milk doesn't have as much iron as the formula. So in certain situations where infants may not have as much iron or may be low, there may need to be some supplementation of iron through a multivitamin advised by their physician or caregiver. So in the ending, wanting to do the best for your baby is what is most important. But from my perspective as a mom, and having done this myself even more than a year for some of my children, I would definitely recommend breastfeeding. It is recommended that we exclusively breastfeed our infants for at least 6 months and optimally going on for at least the first year of life. So I would definitely encourage you to go ahead and breastfeed if you can. Don't let that opportunity pass, especially within the first day of life where you are making that rich colostrum that has much of the elements that your baby needs to stay safe and to grow optimally and to populate their gut with important chemical factors that are only found in mom's breast milk. If you have any questions, please feel free to leave them in the comments below. And specifically, if you have any medical concerns, always seek the help from your personal medical provider, from your child's personal medical provider. Until next time, I will see you soon and be well.